Hi, I'm Dr. Navdeep from TMC Fertility Center. Today, I hope to provide some information about the effect of COVID-19 on fertility, pregnancy, and to answer some questions regarding the subject. Up until a few weeks ago, I know that many of us would have had the notion that this calamity won't happen to us or won't happen to me. We were in denial initially, but in this current situation, the movement control order imposed in our country may be inconvenient, but it is absolutely necessary. So, among the questions that I hope they answer today is regarding the effect of COVID, the pregnancy, the baby, affects your gametes, your sperm, eggs, and your IVF treatment. Is it safe to be pregnant during COVID-19 pandemic? According to WHO, pregnant women do not appear to be at higher risk of severe disease. Furthermore, WHO reported that currently there is no difference between the symptoms of a COVID-19 patient in pregnancy or in a non-pregnant state. Okay? So it's expected that most of the pregnant women will experience only mild or moderate types of symptoms. So based on available information, pregnant women seem to have the same risk as adults who are not pregnant. But what if you have a symptom? Serious symptoms are like continuous cough, fever, shortness of breath, headaches, loss of sense of smell. Okay? Severe symptoms such as pneumonia are more commonly seen in older patients or those with weakened immune systems or those even with long-term diseases such as hypertension, diabetes, and respiratory problems. So the present advice is you should seek medical assistance if you feel that your symptoms are worsening or they're not getting better. So, what should you do if you have fever during your pregnancy? Number one, you should see a doctor in an accident emergency center, private medical centers, or you can go to the government hospitals to seek advice. However, please also be alert that there are other causes of fever in pregnancies. For example, urinary tract infections, where you have burning, discomfort and passing urine, or even some unusual vaginal discharge, or if you have concerns with your baby's movements, please see a doctor. As a general precaution, pregnant women is placed in the vulnerable category as the viral infections can be more problematic for them. Also that some of the medications used in virus-infected patients may not be recommended during pregnancy. So it's sensible that if you have a risk factor, for example, lung diseases, hypertension, or diabetes, then you may want to delay getting pregnant to a later date. It's reassuring to know that the government has prepared many medical facilities and isolation centers for safe delivery and care for women with COVID-19 and safe for their newborn too. As this virus is very new, but so far there's no evidence that suggests an increased risk of miscarriage. It's important that you continue to attend your scheduled routine care when you are well, because maternity care is essential. It has been developed over years to reduce complications in mothers and babies. Okay, so if you have a potential risk of harm to you and the baby, we can detect it earlier. So if possible, please attend your appointments regularly. And the next question everyone has regarding the effect of babies. The transmission from the woman to a baby, called vertical transmission, is probable. In all previously reported cases worldwide, infection was found at least 30 hours after birth, but we are not sure whether transmission was before or soon after birth. Reassuringly, in all the cases reported, the babies recovered, discharged well from the hospital. Given the current evidence, it is considered unlikely that COVID-19 infection would cause any problems to your baby's development, and none have been observed currently. In another case in China, some babies have been born prematurely to women with symptoms of coronavirus, but it was unclear whether the coronavirus caused early labor or whether it was recommended that the baby was born early in order to preserve the mother's health. The UK and the US are currently conducting near real-time surveillance and observation of women who develop COVID-19 during pregnancy and their newborn to gather more information about this. So regarding breastfeeding, if you are confirmed or suspected for coronavirus, when the baby is born, doctors will examine your baby and advise you about their care. There's no evidence showing that the virus can be carried or passed on in breast milk. But the main risk of breastfeeding is close contact between you and the baby. So if you were to cough and sneeze, this will contain droplets which may infect your baby with the virus, leading to an infection in your baby after birth. Nevertheless, breast milk provides protection against many other illnesses and is the best source of nutrition for babies. The other option is you can get somebody else to feed your baby and to take other precautions which are recommended, which are washing hands before touching a baby, use breast pumps or bottles, considering wearing a mask if you want to breastfeed yourself, or otherwise pass the expressed breast milk to another person to help feed your baby. Now, regarding fertility, the other question is, does COVID-19 affect sperms and eggs or IVF treatment? The European Society of Human Reproduction and Embryology reassures that the risk of COVID-19 contamination to gametes, which are sperms and eggs, embryos, in the IVF lab, either from infected patient or staff, is minimal because there's repeated washing and the Sumer techniques used for the sperm preparation. The repeated washing steps required for oocyte and embryo culture too will reduce the risk. Furthermore, freezing protocols which result in high dilution of any possible contaminants. So your sperms, eggs and embryos will be safe. Even with no data available, they assume that the sperms, oocyte and embryos do not have receptors for COVID-19, so are unlikely to be infected. There's a certain receptor utilized by COVID-19, which is the angiotensin converting enzyme 2, which is not expressed in gametes and embryos. Furthermore, the zona pellucida, which is the human eggshell, which acts as a molecular sieve and protects the oocytes and the embryos. So, in general, the advice is to delay getting pregnant. But in patients' ongoing treatment, the treatment will be continued. The other issue is age. Older you get, the more difficult it will be. Hence, if we have to do the procedure, there are a few safety steps that we have to follow. The other reason delay is there may be some logistic problem or some emotional reasons to consider delay. Example, you may have less access to your clinic of your choice. As a precaution, you may consider postponing your pregnancy. So this is a very personal decision, so you should speak to your doctor and get some specific recommendations. As for patients, fertility preservation for cancer patients, the sperm and oocytes or embryo storage for cancer patients is allowed to take place provided there's no symptoms or infection. So these patients are generally immunocompromised, so therefore a shared decision making involving the patient, your oncologist and the fertility doctor is important. How to prevent against the COVID-19 infection? Mainly is personal hygiene, regular hand washings, use of tissue when you or anyone in the family coughs or sneezes, discard them appropriately, wear masks when venturing outside the house, change your clothes and have a bath immediately when returning from outdoors. If possible, work from home. Avoid use public transport or avoid any non-essential travel when possible. Avoid any gathering, be it large or small, because infections spread easily in closed places. Keep in touch using remote technology like phone, internet, social media, and if necessary, contact your GP or other essential service to get advice. And try your best to avoid contacting anyone who is displaying any symptoms of infection. In TMC Fertility Center, we are taking a lot of precautions to protect the staff and the patients. The few things that we are currently doing is that we will facilitate telephone or video consultation to reduce face-to-face encounters. Any patient who walks into the clinic are triaged. Their temperature is checked, and we look for symptoms and also ask them about travel history or risk of exposure. The patient appointments are staggered to reduce waiting time. Patients are encouraged to come alone and practice social distancing while waiting. The scientific staff are in place to maintain and ensure that all these cycles, all the treatments are going on appropriately and safely. And to guard against the risk posed by our staff or the nurses becoming ill, if they are exposed or they have any symptoms, we advise them to get checked and self-isolate. As a safety precaution, all patients are tested for COVID-19 when they start the treatment. Any patient tested negative is allowed to start the treatment cycle and continue onto the egg pickup, IVF and embryo freezing. The treatment cycle will be cancelled if the patient develops any symptoms or is tested positive for COVID-19. This is to protect other patients and the staff. Patients have an option whether to have a fresh transfer or embryo transfer, but this will be after a thorough discussion. Now, regarding COVID-19 screening, the current test available to detect coronavirus is known as the polymerase chain reaction test, which detects the virus genetic material in the mucous membrane. Okay, when you can do put in a swab into your nose, a nasopharyngeal test, and that will be sent to a lab for an assessment and to check whether or not you have any infections or not. The other test will be detect antibodies known as IgM or IgG. Okay, this test cannot detect any early infection which is less than 7 days because there won't be any antibodies detected by that time. Okay, and this test requires your blood test. Whatever it is, the most important thing is stay safe, stay at home, and practice social distancing. Together, we can overcome this COVID-19.